Hey guys, so what do we mean when we're talking about masking related to autistic individuals? What is masking? So for an autistic individual, masking might look like it's basically trying to cover up your natural tendencies. And it might look like forcing yourself to make eye contact with people in a social situation. And it might look like suppressing or stopping stimming. A lot of times they're used for self-regulation and to express express feelings. And then another form of masking that an autistic individual may do is basically forcing themselves not to talk about preferred topics of conversation. And these are all things that, when I was in graduate school for speech pathology and even the beginning of my career, those are therapy techniques that we used to, try to teach autistic individuals or neurodiverse individuals. So research and even autistic individuals who have been able to communicate as adults have discussed how masking can be very damaging. It could have a significant impact on mental health. Autistic adults have actually also spoken about masking causing increased anxiety, depression, and even loss of self-identity. Some other forms of masking could be reducing visual reactions to noises or anything that may be overstimulating for you. Even like hypersensitivity to touch, so like forcing yourself not to flinch when something feels you're hypersensitive to the touch, to the feeling of the object or whatever it may be. Using facial expressions to match other people's facial expressions when it doesn't come naturally to you. And also not sharing interests of yours because it may be perceived as inappropriate or unusual. And then also another one is planning in advance what you would say in a certain situation. So we also call that scripting. So these are some of the examples of masking when we're talking about autistic individuals or neurodiverse individuals. So it's been shown and even reported by autistic individuals who are able to communicate their experience with masking. Well, first of all, masking can also be something that is subconscious or done consciously. And what they've found is that masking is suppressing. For autistic individuals, it could be suppressing, like stimming could be suppressing their way of expressing their emotions and suppressing their needs and instincts. And so this can lead to, again, significant and physical exhaustion, distress behaviors or meltdowns, feelings of isolation, and depression, if I didn't say that already, and even a sense of losing oneself. Why might an autistic individual mask certain tendencies or things that come natural to them? Basically, it's been shown that, or been discussed that they may mask in order to fit in, be accepted in society, maybe to improve employment, like opportunities to get employment, to try to be, avoid discrimination, bullying, that type of thing, and to maybe avoid negative attention or to fit in, and especially in environments where there's not a lot of acceptance or even knowledge of neurodiversity. And maybe even trying to be, form relationships or make friends. And sometimes it's even subconscious because it's become like a routine. Could be because of, past like therapies, and maybe in therapies, they've been instructed to, make eye contact, avoid talking about only their interests, scripting, what they should say in certain situations, and suppressing stimming and all of that. So it's sometimes just because at some point becomes ingrained within the individual.